Hi, this is David Denis, Naturopathic Doctor from naturalhappiness.ca, and I'm here today to interview Kaleb Montgomery, Practitioner of Traditional Chinese Medicine.
That's right.
Welcome.
Thank you, David. I'm excited to be here.
Okay, so I just thought I'd ask you a little bit about how one goes about trying to find somebody to help them in getting pregnant, because I know that's part of what you do. But before we jump into that, why don't you tell us a little bit about your practice?
Sure. Thanks, David. Yeah, I'm a Chinese medicine practitioner, so what that means is I do acupuncture and herbs, and my own practice is focused on helping people get pregnant and stay pregnant.
Right.
Yeah.
Okay, and so what I thought might be helpful for people watching is there might be a lot of people out there who are trying to get pregnant, maybe having some difficulty, and want to look to some other types of practitioners out there who might be able to help them, but might not be sure how to do that. What are some of the things you think are important when looking to find somebody?
Yeah, it's a great question for sure. So they should have curly gray hair. But besides that, what you want to see is, everybody and their dog does fertility stuff now, right?
Okay.
It's all the rage. And so you want to ask them if they have, how long have they been in practice for?
Right.
And then you want to ask them if they have, what kind of any fertility or pregnancy care specific training do they have? Do they have any continuing education in that? It'll probably say that on their website. Fertility is a pretty jargon-rich area, and so even though they're complementary practitioners and they may be a naturopath or Chinese medicine or massage or chiropractor or whatever it is, when you talk to them, they should know what the terms are. They should know what an IVF is, what an IUI is, what an ICSI is, what assisted hatching, all these things. And so if you're talking to them and you mention the terms and they don't know what they are, then that's a good sign that maybe you should, move along.
Right.
No, that's right. So those are a few general things to look at anyway. Yeah.
Okay, and what about specific different types of practitioners and
What they can do.
And offer for
Yeah.
their experience?
There's been some good research out for a long time on acupuncture and fertility. And the Western fertility specialists as well are quite most of them are not only open to it, but they'll recommend it.
Right.
Some of the things you can do, again with back to your first question, not all acupuncturists are created equal. Physio can do acupuncture, a chiropractor can do acupuncture, but you want someone who has, again, fertility specific training and more hours, right? So generally that means, at least in Ontario, that means an acupuncturist, and often naturopathic doctors do too. But again, the naturopathic doctor would have had to have focused on acupuncture after they graduated and have spent some time getting some experience doing that to be really, to be good at that stuff. But what the acupuncture can do, it can, generally, it can help you with the quality of your eggs, with the thickness of your uterine lining.
Right.
It can help you with regulating your hormones. And so all that stuff you can do before to get, help you try and get pregnant in the first place.
Right.
Yeah. I'm not, as I'm saying that, I'm thinking about 10 other things I wanted to say before that. But, there's all sorts of, trying to get the fertility or infertility journey is long and very stressful for people.
Yes.
Couples, whether they're straight couples or gay couples, or you're someone who's single, and there's all sorts of options in that process. And so, and most people are not there necessarily by choice. They're forced into it because they're having difficulties, or they need, they don't have a uterus, or they need sperm, or,
Right.
and so another good thing they should look into is to go to a counselor that has fertility specific training that can help them understand what they want, or what they expect, or what they need. The Western fertility process is a very slippery slope, and from going into just getting tested, because why is it, to find out if the sperm is working, if the woman's uterine lining is good, or her hormones okay, or her fallopian tubes open.
Right.
All those basic tests to get in, but then once you go in, it's anxiety and fear build up, and you're in a hurry because you're however old you are, and it's easy to go from that to an IUI, an intrauterine insemination, or then to, which is about $1,000-ish per cycle or per pop, or up to an IVF, which is like $15,000 per pop, and then you can genetically test the eggs, which is another $6,000.
Right.
And so it's so easy that anxiety and it's so easy to get onto that slope. And so if you can talk to someone who has some, the counselor is a great idea again ahead of time, to talk to someone who's not necessarily invested in getting you further down the road,
Right.
but can give you the information that you need to start making informed decisions.
And I guess that's something you'd want to find in the practitioners you're working with as well, is a certain quality and ability to slow down, hold space for the experience of what it is to be on this particular journey that can be quite quick. And move very quickly and be and maybe capitalize on fear and anxieties that are natural to be having. But you want to be working with people who encourage a kind of spaciousness around the decision-making process and the treatment being recommended.
Yeah, that's right. And to give you the space too, to if that first time you go in and see the IVF doc, right? Like you get bombarded with info, you get a package this thick. You have all these questions in your mind, and then they disappear when you're in there, and they're busy. They're busy. You don't get tons of time with them. So it feels like you're rushed. It feels like you have to make stuff. And so to have someone who has that experience in dealing with that and knows what the process is like and knows what the steps are, and plus, to help you emotionally with that, because it is, I've seen research that shows it's being diagnosed as infertile is as stressful as being diagnosed with cancer. And
I mean, that's where my mind went, because I work a lot with people who are living with cancer, and the slippery slope and the pace of the treatment process is so familiar with cancer. So it's interesting that you've heard of that research.
Yeah, and it's, even though, cancer is obviously life or death, and this is not life or death in the sense of the person, but, if you're 40 and your chance to have a kid, there's a life involved, and that's a big thing. And so it is, no little girl or boy dreams of going through an IVF. Right, when you're trying to become a parent. So already, again, you're being forced into this because of whatever circumstances. So.
All right, well, Kaleb, I mean, I think there's
lots more
a lot more we could talk about. That's probably a lot to get started with.
For sure.
And maybe if people have questions, they can post to the comments, and
I'd be happy to get back on.
We can get back to it. So thanks very much.
Great, thank you.
We'll see you later.
Good.